Welcome back to the Pelvic Health Summit. I'm sitting here with Chad Woodard, who is a physiotherapist and founder of Symbio Physiotherapy, located in Manhattan. There are 2 locations. Thank you so much for being here.
Thanks for having me.
So tell me a little bit about yourself and your practice.
My practice, I've been a physio for going on about 10 years now. And about 2.5 years ago, I started my practice called Symbio Physiotherapy. It has exploded and grown, and lots of reasons that we'll save for a talk about being an entrepreneur, I think, but just loving my team. So we've grown, we're 15 strong now. We've just brought on a new pelvic floor therapist. His name's Adam, and planning to bring on another one this summer. And then myself, of course. They can't get rid of me. And myself, I'm also a full-time professor. I'm an athlete myself, a triathlete, and a general doer of ridiculous things. It's me in a nutshell.
Awesome, thank you. So happy to have you here. So tell us about the common patients you see who are coming in.
Sure. So I see men. I only treat male patients. And then common diagnosis range anything from chronic non-inflammatory prostatitis, or urinary dysfunction, or sexual dysfunction, or sometimes just general pain, right, of a nondescript origin, just things hurt and we don't seem to know why.
Will you tell me a little bit about the patient journey, what happens when they step foot in your practice?
Sure. The journey starts, the patient comes back with me, and just like any other physical therapy or physiotherapy appointment, first thing we do is we chat. And I ask them, what's cooking? How come you're here? What can I help you with? And we do a whole subjective of why they're there and what's going on with their body, specifically their pelvic function that is not going as well as they want it to go. This is usually a point in the first session that most men, I won't say all, but most men are pretty nervous and apprehensive about the situation. A couple of reasons why, and it's quite normal to have that apprehension or those nerves, is number one, they don't know what's going to happen in that session, and they're sitting across from me and they don't know what I'm going to do. So it's my job to explain it and to calm, right? The second reason why there's kind of a lot of pent-up energy in a lot of the guys that I'm seeing is because they've been dealing with some sort of condition in their pelvic floor or in their general health that's just non-ideal. And that could be from long-term sexual dysfunction or erectile dysfunction, or could just be they've had pain and then nobody seems to know why. So they're coming into the situation with quite a backstory, right? So after we chat for a while, then probably my most important job, at least to start their journey, is to convince them that it's not all in their head, because a lot of guys have come to me and they say, I've seen other practitioners and they say, I'm just too stressed out. And I try to decrease my stress, and that makes me more stressed, paradoxically. So to demystify some of that, and then to usually quite helpful, especially for my men, is to say, here's anatomically why you are feeling what you just described you're feeling. And when I can hold up a picture and show these guys, this is the thing, here's what it's doing, and here's how it manifests into your symptoms, like the temperature just cool. Yeah, everybody says, whew, okay, or they say, so you're saying I'm not crazy, right? And at this point, I'm a hugger, right? So I just want to reach out and it's okay, dude. Yes, you're not crazy. Everything's fine. So that's step one. And then based on what we find and what we do, then we continue on to answering questions, treatment, home exercises, factors that are propagating these symptoms. And then we go through just one step at a time, just like any other, just like if your knee hurt or something.
Awesome. Yeah. That's super helpful to just kind of understand the process. So for those people who are out there who aren't in New York, what are some common at-home things that they could do maybe to just relax or feel into their body before they go and reach out to someone who has a similar expertise?
Mm-hmm. Don't go to Google and type in your symptoms. That usually makes it worse. Don't go to Google and type in your symptoms. But if you do, which everybody does anyway, common at-home things that I would say, even if they haven't come in to see me or one of my team, is learning how to breathe, which sounds kind of a minuscule thing, but truly doing just deep belly breaths, and then just relaxation cues. often, no matter what the condition, most of my men, that's the first thing they need anyway, is me teaching them how to take a nice deep breath, and then also a cue that does relax their pelvic floor. Because that's mostly what I am seeing is just pelvic floors that are all wound up and in spasm. So if I teach a fellow how to breathe and then give them a couple of cues, as you're laying down and breathing, can you imagine the two bones you're sitting on, your sits bones? Can you imagine them just drifting apart? They're like, yep. I'm like, great. There's your homework, right? And often they don't need me to do anything magical or radical. It's just remembering to breathe. And then the second thing that I almost universally, every male patient that I see, in addition to all patients in general, is just good balanced movement, whatever that means. That could be from, whatever the activity level is now to the next step. So that might be somebody just going out for a walk or doing some sort of, group class that feels good to their body, but just doing some sort of movement to keep the hips and the pelvis just moving in a more optimal, ideal way.
Awesome. So tell us, what are common myths around, especially men with pelvic floor and pelvic pain dysfunction that you can address, other than the big one that you're not crazy, which has been a theme this whole time. It's so important.
Yeah. Common myths. You're not crazy. There is a reason why this is happening. I will say that there is a very common and an expected emotional link to having a pelvic floor that isn't functioning the way we want it to. And if I can, speak frankly, it's whether it be a cultural thing or a societal thing, almost any man that has had one experience of not being able to stay hard as long as they want to, right? And then in their brain, now they have the two dreaded letters, ED, right? Then the next time that they are in a sexual experience or with a partner, then the first thing they think about is, oh God, what if it happens again, right? So it's super normal, and I've yet to meet a male that hasn't experienced that at some point. I mean, and if they're past the age of 14, right? So there is this emotional, oh my gosh, what if it happens again? Or what does that mean about me? Or, if we're in a certain stage of life or something, oh, well, I'm in my mid-30s, so it's just normal now that I can't have sex like I used to. So there's a lot of attachments to having a pelvic floor that isn't working the way that a man might want it to. So there is that association with, the dread of, oh God, if it happens again. But yeah, other common, I think, myths are, oh, well, I read on Google that I'm, 38 years old, and that means my testosterone is naturally supposed to lower, and so that means that I shouldn't be as sexually active, and even though I really want to be, so this is just life. This is my body changing. I'll acknowledge, of course, as the body ages, it does change, but to kind of resign yourself to a lifestyle that isn't optimal is garbage.
Definitely. Garbage.
It's a strong word.
It's a very strong word, but it's important to advocate for yourself and to live your best life and the life you want. So we touched upon erectile dysfunction. Can you share a little bit more about other pelvic pain conditions that you treat?
Sure. One of my favorites, because it's my least favorite, is the non-inflammatory or non-bacterial prostatitis, which basically means that it's not prostatitis. So when pelvic floor spasms in a man, it mimics the symptoms of a prostate that is inflamed or infected. And so what a lot of guys that come to me with that diagnosis, their story very often is, well, I went and I got prescribed antibiotics, and I went on those for 7 to 30 days, depending on the antibiotic. And then, of course, then I ask, did it help? And the answer is usually, kind of, right? So if there's anything other than, yes, that helped, then it wasn't a bacterial infection, right? Or the antibiotic was incorrect. But if they say, maybe it kind of helped, then that tells me, cool, well, that wasn't a bacterial problem. The problem with that is then these guys go on and off antibiotics for a very long time, and because it's just misdiagnosed. And then that leads to other things like digestive issues or, misdiagnosed irritable bowel syndrome or whatever, right, because of this prolonged antibiotic use. So I see a lot of guys with that, and really all it is just like, I don't know, you can kind of make the analogy to getting a cramp in your calf at night, right? A Charlie horse or a spasm. So it's just you have these muscles in your pelvic floor that when they go into spasm, it mimics the signs of prostatitis, which is burning or pain with urination or ejaculation, or it could even be pain with erection or pain with sitting or whatever. So it sounds a lot like prostatitis. So I see a lot of guys with that. Erectile dysfunction, usually guys will come in and they won't tell me about their erectile dysfunction, but there's a very few number of people that come in with pelvic floor dysfunction that don't also have erectile dysfunction, and there's a perfectly reasonable reason for that, because one of the muscles called ischial-cavernosus that's responsible for erections is in the pelvic floor, so if that muscle can't function, neither does the penis, right? It just doesn't work. So usually that comes along with it, right? That's the baggage that they nervously don't want to tell me, and I'm like, yep, got it, I get it. And then also just kind of other general diagnoses that I see are going to be nondescript pain or a very specific pain. So by nondescript, I mean like, yep, it hurts right where I sit on a chair or where I would sit on a bicycle. Or I have pain at the tip of my penis. Or when I run really far, my left nut really hurts or whatever, right? So some sort of a pain diagnosis somewhere. Those are probably the most common.
Thank you. Can you tell me a little bit more about when someone comes in and they've been diagnosed, what's kind of the protocol of working with different practitioners to kind of round out that team approach to care?
Yeah. So team approach, I mean, the first thing I would say that's on my mind is pelvic floor dysfunction can be a symptom of a general health condition of some kind, right? A cardiovascular thing, a blood sugar thing. So, so probably the first person in mind that I want to make sure that I'm collaborating with is their general practitioner or the referring physician, just to make sure that we've cleared any other general health things, that they are overall a healthy person, and that they're appropriate to come in to see a physiotherapist. Otherwise, it depends on their situation, right? So I might collaborate quite closely with a urologist if they have a urinary dysfunction of some kind. I might collaborate with a proctologist or a colorectal specialist if they're having trouble with bowel function or incontinence. Depending on how strongly they are attached to kind of the emotional side of their condition, then a talk therapist might be great, or a psychotherapist, something, or even a social worker, just so that way they have kind of an outlet to talk about how this has affected the rest of their life. So otherwise, different physicians, depending on what their specialty is, but those are probably the bigger players.
Awesome. Yeah. Are any of these conditions preventable, or is there something that you're seeing people come in with and maybe they didn't know not to or to do something that could lessen the symptoms or have prevented the condition?
Yeah, preventative. Well, you're asking a physical therapist, right? So, if you have a hammer, everything looks like nails. But my bias is towards general health is the magical thing, the gift I give to most of my patients is telling them not only that it's safe to move, but healthy movement will in fact manage a vast majority of their symptoms. Mm-hmm. They don't really need me to do anything, drastic. So one of the first things that I tell my guys is to do some sort of hip mobility, right? And that could be a yoga class if they jive with that. Or at my clinic, we teach a thing called Ken Stretch, which works on opening up your hips and the anatomy of the hips and even the thighs, right? The muscles, the fascia blend completely intimately with the muscles in the fascia of the pelvic floor. So, I don't know, if you line up, 100 guys and you tell them to start salsa dancing, right? Then we all giggle because most men, we're like, what do you mean move my hips? I don't understand the words. So we don't do salsa dancing at Symbio, but yet. But getting people just to be able to move their hips is often a rehabilitative thing, but absolutely a preventative thing as well, can be a preventative thing, just because of those anatomical connections. Otherwise, preventative, this is my annoying answer, is just more general overall health, right? Optimal sleep, stress management, hydration, nutrition, fitness, all of those things often lead to a dysfunctional pelvic floor as well.
So how do most of your patients come to you? How do they find you? Is a partner telling them to, go in, or is it a doctor? Are they finding you on their own?
Probably the tried and true way that people don't find me is from my current patients, right? Because most men aren't going to sit down with a bunch of their buddies over a few beers and be like, guys, let me tell you about my dysfunctional pelvic floor. This is a great story. That's usually not what's happening. So it's often not a word of mouth referral. However, I'm finding people that have found me and I don't even know how it's happened. Part of it, I think, is because I'm a male therapist treating men, that either something gets written up or somebody does Google it, or a referring provider, of course. If a patient is telling their urologist, yeah, I have to go into PT, but I prefer to have a male therapist, then that's just, I think, kind of a bypass to a normal referral source. But I think also it's happening quite organically. I just got a patient a couple of nights ago and got my name from a mental health provider, and I have no idea who that person is, nor how they found out who I am, but here they are, right? So I think a lot of it's just word of mouth. Then there's things like this, right, of just having general awareness. I have been shocked at the number of men that I'm now treating that came to us because of some other diagnosis. But as I'm sitting and talking to them about their back pain, they're basically just telling me almost verbatim, oh, it's actually my pelvic floor that's a dysfunction. But one weightlifter that I treated, a power lifter, he had a little bit of urinary incontinence and some pelvic pain, erectile dysfunction, and I knew him quite well, so we were just having a chat about it. And I said, oh, well, that's your pelvic floor, let me treat that. And had a fantastic result. And, not to say this is a norm, but we had one session and poof, everything was great, right? And then just a maintenance program. He then went and told all of his weightlifter friends, because so many of them have it, but we absolutely can't talk about it. So he mentioned, oh, I had this crazy thing, you should go and see my friend Chad over at Symbio, and then in they come, right? So I think some word of mouth, but a lot of, kind of back channels.
Definitely. That was a great success story. Do you have any others that you could share with us?
Not a single one. No. Great success stories. Gosh, lots of them. I would say almost without fail, it's probably a safe thing to say that even session 1 is almost universally somewhat successful. Because as I had mentioned, kind of that common story that men come to see me with is, people have told me that I'm crazy, or that I, am making this up, or the antibiotic should have worked, or I'm just too stressed out, or whatever. Just them sitting down and having a really open, sometimes a little scary, but conversation about it, and then having somebody with a bunch of letters after the name say, it's okay. Here's why that's happening. And truly, like, the magical part is like me showing them a picture. I'm like, see that muscle right there? And they're like, that one? Yep, that's the one. That thing is in spasm, I bet. And that's why everything is happening. And like immediate people are like, oh, I feel better. And truly, I'll say, how are your symptoms right now that you know that? They're actually a little bit better. I'm like, cool. So you're not crazy, but you see how like de-threatening it has actually changed your symptoms, then that can be quite powerful. But other success stories, I had this guy, God bless him, he had pain for 25 years. And this is probably the longest history that I took. He had this lower back pain and hip pain. He didn't even really have a lot of pelvic pain, but he just had this lower back pain that just was persistent, and he went to lots of different practitioners. And was always, did lots of core strengthening and interventions with just general health, and got all of the MRIs and the x-rays, and everything came back normal, and nobody could really tell him why it was his back pain. And then within one session, I found there's this muscle called obturator internus, and the moment I touched that muscle, he was like, that's my back pain. Like, you touching that muscle is turning on my back pain. And I wanted to shoot off streamers, because it was 25 years you've been dealing with this, and it's just this hip muscle. So we worked on that, and he stood up and he was like, that's the first time I haven't had back pain in 25 years. Mm-hmm. So it took us a while for his body to then figure out that it didn't have to spasm that muscle or overuse that muscle. So it was a journey for us, but such an amazing experience that a quarter of a century this guy has had pain in his back, and it was like, oh, well, it was that thing. Right? So very validating, right? Usually I mess it up totally, but that wasn't good.
No, these stories are so important for hope, you know, because so many of us have been misdiagnosed and have been running around and being told that we're crazy. So hearing the success stories, I always like to ask because they are the hope. So thank you so much for being here. Can you tell everyone where we can find you?
Sure. So online is, you know, the day and age. I'm all over the social media things. Ask Dr. Chad is my handle, so ASKDR Chad. My website is www.symbiopt.com. That's SYM as in Mary, BIO. And then we have our offices. I personally treat patients in our Chelsea office, and that's where our other pelvic floor specialist, Adam, he works there as well in our Chelsea office. And, you know, on forums and conferences and things like that.
So for those of our viewers who are out there who maybe can't come in and see you, do you have any online resources for men's health that you can recommend?
Sure, yeah. So I think both for patients and practitioners, I did my training through a company called Herman and Wallace. And they're quite well known, especially in the physical therapy paradigm for pelvic health, both male and female. So that's where I did my training, and I think that they do a really nice job. They also have blogs and informational, you know, segments, and it's a great place, I think, to get good, reliable information that isn't, you know, the Dr. Google terrifying stuff that nobody should read. So I'd say that. I know that we're currently working on a blog for men's health and that. I'm part of a Facebook group, you know, men's physiotherapy and men's health Facebook group, so those can be kind of nice. Most often I'm finding, at least with the patients, my male patients, is for them to know that this is not a unique thing to them, that other guys have had these symptoms, that I think can be quite helpful. And that might even be a good resource, you know, if there's a Facebook group of some kind, you know, that perhaps you can join anonymously so nobody knows that, you know, you're in this dreaded thing called a men's, you know, pelvic floor Facebook group or whatever it is. But there's definitely resources out there that are going to be having, you know, a higher quality or a more accurate level of information that are not as threatening.
Awesome, thank you so much. And I will link all of that in the group so you can go and do your own research. Awesome, thank you so much.
You're welcome, my pleasure.
Thank you so much for joining us. Now I'd like to hear from you. Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.